Surgical treatment of otohematoma in dogs. In the table of contents, we have first the definition of otohematoma, second, the background of the animal, third, the cause, fourth, the previous symptoms, fifth, the procedure, and finally, the conclusion.
The patient has an auricular hematoma. The auricular hematoma is an accumulation of blood located at the subchondral or intracaudal level of the pinna. The procedure consists of making an incision of the tissue overlying the hematoma, evacuation of blood clots and fibrine. The cartilage is kept in position with suture until scar tissue is formed. In some cases, an drainage canula is left unplugged to avoid fluid accumulation. Auricular hematoma may be caused by esophageal scratching of the sudden movements of the head.
It develops most frequently in pendulous earth canis and occasionally in cats. Some animals have no history of repetitive trauma, and hematoma formation may be associated with capillary fragility, as in Cushing disease.
Auricular hematoma may be caused by excessive scratching or sudden movements of the head. Acute or chronic inflammation of the ear have been mentioned as underlying causes, which provoke scratching, such as parasites, allergies, seborrhea problems, bacterial infections, Streptococcus, Pseudomonas, Candida albicans.
Symptoms. The dog was presenting the following symptoms for about 3 days: constant shaking of the head, scratching of the ear if there is itching, nervousness, you cry because of the pain, ear reddened and hot to the touch, decay, fever, rare symptom. 1. The doctor is observing the bulging area to determine if it is possible a surgery. 2. After observing the things, vet is diagnosing an otohematoma. 3. Medical assistant is sedating the animal and supplying analgesia with morphine reason so the dog won't hurt itself. 4. The animal is in the operating room, anesthetized with isoflurane. The doctor is disinfecting the area with iodine solution before the surgery. 5. Subsequently, the medical assistant is shaving the area to have a better field of vision during surgery and properly disinfection to obtain good asepsis. 6. When the doctor cut with the scalpel the non-coagulated blood, the vet is marking the incision in the most declivitous area of the otohematoma, increasing in size until it is large enough to completely evacuate it. 7. The doctor carefully removing the clots and fragmented pieces of cartilage to avoid further damage to the vessels. 8. Once the cavity has been emptied, we are washing it with saline solution and suturing it with sample stitches. Place the stitches vertically. This doesn't obstruct the arterial vessels that flow in this direction. 9. At the end, we are leaving a Penrose drain in place to perform washes with the saline solution and introduce the antibiotic or a gauze impregnated with antibiotics. 10. Finally, the doctor is applying a compressive bandage to prevent recurrence and ensure tissue opposition. It is important that bandage doesn't move. Dogs immobility the patient using a larger bandage so animal won't escape or hurt itself.
Conclusion. The time in which the otohematoma is diagnosed is important and preventing it more. Therefore, if your dog shakes his head frequently, go to your vet as soon as possible to treat the cause and avoid this annoying pathology.